period. Even that, though, maybe is still going a little bit back in time, and so what other alternatives are available to deal with these tails? One approach that's being proposed is a cocktail of assays, or an algorithm that uses multiple assays to try to weed out that tail of the distribution, those elite controllers. So it's still a snapshot cross-sectional sample. You give people an HIV test, then you also give them a CD4 count test to take out people who have AIDS. You then test them with the assay to see if they're in the window using this biomarker. And then you add an additional test of HIV RNA to test their viral loads, and if they have low viral loads, to take them out of the mix of people who are in the window period as well, to try to take out the tails, the people who are elite, what are called elite controllers.
What about defining different nuances
It's fine.
So nuance.
Right. You mean have different news for the different subgroups? I don't know. I have to. Yeah, I'm not sure. Let's see. How am I doing on time? Let me. I'm almost done. So let me wrap up, and then we'll. Okay. So. Anyway, so I'll wrap up now. That what's new in HIV forecasting methodology? We have some new tools. Three big tools that we have. One is that's new on the horizon, this extended back calculation method. The second is these national household surveys, such as the demographic and health surveys that are being conducted in many countries. And the third are these new biomarker estimates of HIV incidence. And they've got challenges, all of these. Extended back calculation involves all the issues with quantifying the uncertainties and changing surveillance systems. The different states who are reporting HIV testing is changing, and it's not being consistent over time. The national household surveys that are being done, such as the demographic and health surveys, we have issues of non-response bias, which have not been thoroughly studied in those studies. And in the biomarker estimates of HIV incidence, there are uncertainties about the window period and also the representativeness of the, so what is the tail of the distribution, also representativeness of the cross-sectional or snapshot sample. So lots of challenges here. I think there are a couple of big opportunities. And I think the big opportunities to really improve our ability to measure the HIV epidemic comes from merging some of these new tools together. Here's one that I particularly like. Combining the national household seroprevalence studies, such as the demographic and health surveys, with biomarkers assays for recent infection. Why I like that hasn't been done yet, and I think it would be really easy to do. It's very cost effective. These studies are already out in the field. They're already collecting serum samples. So all they have to do is test the positive serum samples with the biomarker assay to see if they're in the window period. So it's extraordinarily cost effective, and you already have a quote, nationally representative sample, at least in some countries. So you can then get a direct population estimate of HIV incidence. Furthermore, with repeat surveys, and the demographic and health surveys are being planned to be repeated every few years, if you can estimate incidence at one point in time, you can estimate at 2 points in time, so we can estimate changes in incidence and get our first estimate, direct estimates of change in population HIV incidence. Another opportunity that I see is, again, working with the demographic and health surveys to take that and do a follow-up sub-study, mortality sub-study on people in the demographic DHS. And that could provide input to estimate incidence from a change wouldn't hang my hat too much on this, but it could help corroborate findings from a biomarker study about HIV incidence. And I think it's all about corroboration using multiple technologies. So finally, some big issues. First, why do estimates matter? Why do any of these national and global statistics matter on HIV? Well, it's all about policy, and people want to know if the epidemic's going up or down. They want to know if we're spending our resources appropriately, if we're targeting the right groups. We want to do evaluations of major programs like PEPFAR and so forth, and to know if the big picture in terms of the measuring the HIV epidemic. The prevalence is hard. HIV prevalence is hard, but estimating HIV incidence is even harder. There are lots of uncertainties with all of the approaches that I've mentioned. I think the key thing here is that multiple approaches help and increase confidence. In the current estimate of HIV incidence using both the biomarker approach on one hand and an extended back calculation approach on another helps increase confidence in the results. So why have the statistics been changing so much? When we started, we saw the changes in UNAIDS estimates and so forth, and CDC's estimates. Well, a principal reason is that the methodology is changing. A lot of these tools we didn't have before. We didn't have the demographic and health surveys before. We didn't have the biomarker approach before. So it's changing methods and changing data sources. So the yardstick that we're using to measure the epidemic is changing. The real challenge, I think, is teasing out, are these real changes also going on underlying the epidemic? And that's actually much harder to figure out, to tease out if it's the methodological and data changes or are they real changes. And the reason it's so hard is because we don't have a consistent data series over time. So what do we have? Well, we have the antenatal clinic data. That we have a long time series in many countries, surveys of pregnant women. And people have been studying that and looking to see the trends. Can we infer something about the long-term trend in the epidemic from that? But then there are the issues of changing people who are coming to the antenatal clinics, changing catchment areas, and so forth, which makes it really hard to disentangle and separate out what's a methodological or data change versus what's a real underlying change in the epidemic. I think that's a big challenge. And it's a big challenge because I think what it's really all about is not a single number, but it is about tracking trends and wanting to know, are we winning, are we making inroads and winning the HIV prevention war? I think there are a lot of challenges to it, but I do see on the horizon some opportunities, particularly with some of these new technologies like biomarkers and also with some of the new epidemiological studies such as these large demographic and health surveys. So I think I'll stop. So, for example, with the demographic and health surveys, whether those sera have been stored. Actually, I don't know the answer to that. Whether the sera has been stored and whether they could be made available for the biomarker. Certainly, those studies are ongoing, and I think the sooner we get those in place. And I also don't know, and maybe someone else knows the answer to this in terms of how long the sera could be stored for some of these biomarker assays to be effective. I don't think there's a storage issue, but maybe someone else knows. So, but